Are you taking your blood pressure medication at the most dangerous time? You've likely experienced the familiar scenario. Your doctor prescribes a blood pressure medication, advising you to take one tablet daily. For countless individuals over 60, this routine involves faithfully taking their pill each morning, often with a cup of coffee, much like millions of others across the country. However, what your physician may not have explicitly detailed is the profound impact that not only when you take your medication, but also what you take it with can have on your cardiovascular health. This isn't a minor nuance. Research indicates a substantial difference that can either safeguard your heart or leave it critically exposed. Studies such as the extensive Haya chronotherapy trial involving over 19,000 patients followed for 6 years have yielded results so compelling that lead cardiologists have labeled medication timing as one of the most overlooked risk factors in managing hypertension. This comprehensive analysis reveals five critical timing related mistakes that individuals on blood pressure medication commonly make, with some being particularly unexpected. The first, a seemingly innocuous error embedded within your morning routine, is often the last thing people would suspect as problematic. As Dr. William Lee, an internist and cardiovascular researcher with 35 years of experience, explains on his channel dedicated to vital heart health conversations extending beyond brief clinical appointments, the science behind blood pressure management, especially for those over 60, is deeply connected to our body's natural biological clock, known as the circadian rhythm. This internal rhythm dictates significant physiological changes, including blood pressure, which typically experiences a dip of 10-20% during sleep, a phenomenon termed nocturnal dipping. Crucially, as morning approaches, usually between 4 and 10 a.m., blood pressure experiences a sharp surge in preparation for the day's activities, the morning surge. The implications of this surge are significant. Research published in the journal Hypertension highlights that this early morning rise is responsible for a staggering 49% of all strokes and 40% of all heart attacks within a 24-hour period. This danger is amplified as we age past 60, when arterial walls lose up to 30% of their elasticity, making the morning surge even more perilous. Therefore, it is imperative that your medication is actively working during this critical window, a factor entirely dependent on your dosing schedule. A common misconception involves the perceived harmlessness of morning coffee. Many doctors, like patients, consider it a benign part of a morning ritual. However, for individuals prescribed beta blockers such as metoprolol, atenolol, or carvedilol, that morning cup of coffee can actively counteract the medication's intended effects. The mechanism is rooted in the interplay between caffeine and your sympathetic nervous system. Caffeine acts as a stimulant, essentially pressing the gas pedal of your cardiovascular system by increasing heart rate, triggering adrenaline, and temporarily elevating blood pressure. Beta blockers, conversely, function by applying the brake, slowing the heart rate, and diminishing the force of contractions. When you ingest your beta blocker and consume coffee within a close proximity, such as a 30-minute window, you are essentially engaged in a physiological tug of war, simultaneously accelerating and decelerating your cardiovascular system. While in most cases, the medication will prevail. For patients with a history of arrhythmias or irregular heartbeats, this internal conflict can lead to palpitations. A study from the Mayo Clinic's Cardiovascular Research Program observed that patients on beta blockers who consumed more than 2 cups of coffee within an hour of taking their medication exhibited a 22% higher incidence of symptomatic palpitations compared to those who spaced their coffee intake by at least 45 minutes. Margaret H., a 68-year-old retired teacher, experienced this firsthand, complaining of morning chest fluttering. Her routine involved coffee at 7:30 a.m. and her metoprolol at 7:45 a.m. Upon shifting her medication to 7 a.m. and her coffee to 7:50 a.m., her palpitations resolved within 2 weeks. This underscores a simple yet crucial guideline. If you are on a beta blocker, wait a minimum of 45 minutes between taking your medication and consuming your first cup of coffee, allowing your stomach to clear the medication. Decaffeinated coffee, lacking the same stimulating compounds, does not pose this interaction risk. As a synergy tip, pairing your medication with a glass of water can aid consistent absorption and mitigate interaction spikes. Another significant interaction to be aware of involves grapefruit and its juice. While many are aware of potential medication interactions with grapefruit, the duration of this effect is often underestimated. Grapefruit contains furanocoumarins, compounds that can significantly impair the function of a crucial enzyme in your digestive system, CYP3A4, responsible for regulating drug metabolism. This enzyme's activity can be inhibited for up to 72 hours after grapefruit consumption. For calcium channel blockers such as felodipine, nifedipine, and amlodipine, this inhibition leads to their processed blood levels rising to 2, 3, or even 5 times the intended concentration. The consequence is an exaggerated drop in blood pressure, causing dizziness, lightheadedness, and potentially dangerous fainting episodes, particularly in older adults with already diminished vascular tone. A study at the University of Toronto tracked 2,191 patients over 3 years and found that those who consumed grapefruit products within 72 hours of taking their medication had a 31% higher rate of hypotensive episodes compared to those who avoided it. Robert D., a 72-year-old retired electrician, experienced a dramatic instance of this when he collapsed due to dangerously low blood pressure after his wife introduced a new citrus blend juice containing grapefruit into his diet. If you are taking any calcium channel blocker, it is essential to consult your pharmacist about grapefruit interaction risks. To err on the side of caution, it is advisable to avoid grapefruit products entirely and opt for alternatives like orange juice, apple juice, or water. A helpful synergy tip suggests that incorporating magnesium rich foods such as spinach and almonds alongside your calcium channel blocker may help stabilize vascular tone without adverse drug interactions. Consulting your doctor about monitoring magnesium levels is also recommended for those on long term calcium channel blocker therapy. The third timing mistake, often perceived as benign, can lead to severe consequences, particularly for individuals over 70. Diuretics, commonly known as water pills, are frequently prescribed for blood pressure management. Medications like hydrochlorothiazide, furosemide, and chlorthalidone work by prompting the kidneys to excrete excess fluid, thereby reducing blood volume and lowering blood pressure. The issue arises when these medications are taken in the late afternoon or evening, often due to forgetfulness or a lack of specific timing instructions. This can lead to the drug reaching its peak effect in the middle of the night, prompting frequent urination and subsequent awakenings. When a person, particularly an older adult, gets out of bed in the dark with blood pressure that can fluctuate upon standing, a condition known as orthostatic hypotension, affecting nearly 30% of adults over 70, the risk of falling is significantly elevated. Nighttime falls in adults over 70 are a leading cause of hip fractures, and tragically, hip fractures carry a 1-year mortality rate of 20-30%. A Brigham and Women's Hospital analysis found that patients taking their diuretics after 2 p.m. had a 44% higher rate of nighttime falls requiring emergency care. Patricia W., a 74-year-old retired librarian, experienced this disruption, waking multiple times nightly due to her evening diuretic dose. After her medication was moved to 8 a.m., she reported sleeping through the night and feeling like she had her life back. The rule here is straightforward. Diuretics should be taken before 10 a.m., and if a twice daily dose is prescribed, the second dose should be taken no later than 2 p.m. To support potassium levels, which diuretics can deplete, pairing your morning diuretic with a banana or a small serving of plain yogurt is a beneficial synergy tip. A mistake almost universally made is the impulse to double up on medication after missing a dose. While this might seem like a logical way to compensate, for certain medications, it can trigger a cardiovascular emergency. For calcium channel blockers or long-acting ARBs like valsartan or losartan, doubling the dose can cause a sudden and dramatic drop in blood pressure. In younger individuals with elastic arteries, the body may adapt, but in older adults with reduced vascular tone and potential coronary artery disease, this sharp drop can lead to fainting, syncope, and even ischemia, or insufficient blood flow to the heart or brain. A less apparent but equally dangerous version of this error occurs when individuals prescribed twice daily medications begin taking them only once daily, finding it more convenient. While blood pressure may appear partially controlled, the medication's intended protective effect is halved. A Johns Hopkins University study found that patients who doubled up on doses after missed doses had a 38% higher incidence of emergency hypertensive crises. Furthermore, inconsistently taking twice daily medications was linked to a 26% higher rate of cardiovascular hospitalization. Dennis M., a 66-year-old contractor, developed a habit of taking double doses of amlodipine and valsartan in the evening due to his unpredictable work schedule, leading to him being found unconscious with critically low blood pressure. The protocol for missed doses is clear. Take the missed dose as soon as you remember, unless your next scheduled dose is less than 4 hours away. If it is close to your next dose, skip the missed dose entirely and resume your normal schedule. Never double a dose without consulting your pharmacist, as the correct approach depends entirely on the specific medication. A powerful synergy tip to combat missed doses is setting a daily phone alarm, ideally linked to a specific daily activity like eating or brushing teeth, which has been shown to significantly reduce missed doses. Finally, we arrive at the most critical timing mistake, a fundamental misalignment between how blood pressure prescriptions are typically written and what current scientific evidence strongly suggests. For decades, the default instruction for blood pressure medication has been to take it once daily in the morning. This practice originated from an era before a deep understanding of circadian biology. Today, we know that blood pressure follows a precise rhythm, surging sharply in the early morning hours between 4 and 10 a.m., a period that represents the most dangerous cardiovascular window. Taking medication in the morning means it reaches peak concentration around 9 or 10 a.m., precisely as the morning surge is beginning to subside. By the next morning, when the surge is building again, the medication's concentration has been declining for 18 to 20 hours, leaving arteries least protected when they are most vulnerable. Switching to a bedtime dose dramatically alters this dynamic. Taking medication at 10 p.m. ensures that by 4 a.m. it is at or near peak concentration, offering full protection during the morning surge. The Haya chronotherapy trial, a landmark study involving over 19,000 patients, found that those who took their antihypertensive medication at bedtime experienced a 45% reduction in cardiovascular death, heart attack, heart failure, and stroke compared to the morning dosing group. While some researchers have questioned the methodology of this trial and subsequent studies have shown mixed results, the consensus is that bedtime dosing has not been proven harmful and may offer substantial benefits for many patients, particularly those with non-dipping blood pressure patterns. The definitive way to ascertain your personal need for adjusted timing is through a 24-hour ambulatory blood pressure monitor, a tool that reveals your individual circadian blood pressure pattern. The most impactful action you can take is to ask your doctor at your next appointment if bedtime dosing might be more beneficial for you and whether an ambulatory blood pressure monitor would be helpful in making that decision. For those considering a switch to bedtime dosing, taking the medication 30 minutes before lying down allows for proper absorption, and aligning it with a consistent bedtime routine, perhaps even considering melatonin's natural role in regulating sleep cycles, can further optimize the benefits. As Dr. Lee emphasizes, modern medicine's ability to intervene in biological rhythms and reduce cardiovascular risk through medication is a remarkable achievement. Medications are tools, and their effectiveness is significantly influenced by how they are used. Aging is a natural process, but the dangers posed by the morning surge, suboptimal medication timing, and hidden interactions are not inevitable. They are variables that can be managed with knowledge and informed decisions. This channel is dedicated to empowering individuals with that knowledge, ensuring everyone, regardless of age, has the dignity of understanding their health. The question posed to viewers is which of these 5 critical mistakes was most surprising and which one they will act upon immediately. Sharing these experiences in the comments section along with age can offer invaluable insights to others. Subscribing to the channel provides access to weekly videos that translate peer-reviewed science into practical, evidence-based guidance, particularly for adults over 60, ensuring they receive the honest explanations they deserve about their health.